Hey everybody, it's Dr. Nicole Friels here. Well, today I'm going to watch Dr. Carter's ingrown toenail removal so we can give her good critiques, and honestly, I can really explain what she's doing and why she's doing it. So let's get started. So the toe's already been prepped. At this point, she's going to check to make sure that the patient's nice and numb. She's putting a tourniquet on. The purpose of the tourniquet is to, whenever we apply the chemical, we don't want too much blood flow because that blood flow can really wash the chemical out. So really important to use a tourniquet. Some doctors do not. However, that's particularly why we choose that technique. So she's now just freeing up the nail beds. A lot of times that skin really attaches to the nail, and so we have to free that up. Otherwise, we're just fighting to get that nail away from the skin because it's really strong, believe it or not, especially underneath. If you think about all that skin, that nail bed is perfectly adhered to it. So she's now loosening up the edge and getting underneath of the nail. It's really important to go all the way back because that's where the matrix or the nail root is. I have seen regrowth of ingrown toenails, and that's because they didn't go all the way back to get the root. The root is going to look like this glistening, shiny, almost like a tendon. So if you don't see that when you fully remove it, then you know you haven't gotten it. So keep digging. And sometimes I'll have to take a smaller instrument to be able to get up under there, especially in women. So she's now just using a hemostat to get, and you'll see she's going to go all the way back and then just kind of rotate it out. Oh, you see that white piece at the tip? It's under her finger. There you go. That's that glistening. It's got some blood on it. So it's a little hard to see it, but you can see how far that went back into it. So a lot of people dig these out and they continue to come back. So if you want it done for good, you really want to come to see us or another podiatrist to be able to remove that. She's now taking a curette and removing any excessive tissue and just making sure that that area is nice and fresh and clean. She's using now some nippers just to clean out that skin. I told you, once that ingrown happens, the skin and the ingrown just start fighting each other. So that skin again gets really hard. So when it heals, we don't want that hard skin because it's gonna feel like there's an ingrown toenail still. So she's gonna go ahead and clean that up. Again, reducing any excessive tissue. This will allow it to heal much faster. So we should be coming up on chemical next. Oh, this lady, I see she's got half of her nail polish still on. By the way, if you leave your nail polish on long term, that can cause a fungal infection. So let's see here, zoom in a little bit. We are still cleaning up the tissue. Well, I tell you what, Dr. Carter's pretty good paying attention to detail. Oh, I can't see anything. Who filmed this? Oh, wait. Yeah, it's really hard to say. She's applying chemical to prevent the regrowth. This is sodium hydroxide. So what that's going to do is kill the root of the nail. So the goal will be that ingrown doesn't come back. A lot of people think that we remove the nail entirely. We don't need to do that unless it's severely infected and the nail is already lifting up off of it because of the infection. There was a pus pocket in there, so that has been drained. Who filmed this? Oh, zoom in. Oh! Okay, there we go. That makes sense, Bobby. What would I do without you? Okay, so I thought, what in the world is happening? Okay, all cleaned up. So now that blood flow is going to get back in there, and it's really important if you do have poor circulation, you don't want to elevate your leg after a procedure like this. You want that dangling down because we want gravity to really pull down circulation to get it to heal as quick as possible. Okay, she's just wrapping it up. Good job. Boy, she's got a lot of jewelry on here. Old Joan Jett-esque. All right, and I think she probably is going to do her smiley face, which I think is her signature move. Does she do that on all of them, Bobby? Mm-hmm. She does. That's cute. I might have to steal that. Yep, there she is. All right. Well, excellent job, Dr. Carter. I highly approve. Wonderful attention to detail. Infections cleaned up. This patient's going to come back in a couple weeks just to make sure everything is completely resolved. The moral of the story is if you have pain in your toenail, please see a podiatrist because we know it's ingrown. Even if it doesn't look like it's ingrown, just have it checked out. We can do some simple soaks, things like that. In fact, there's a soak called Relax. It's a medicated soak that has citric acid in it, which is a wonderful healing agent. It's also great for fighting fungus as well, and really kind of just softening everything up, which makes the, if you have an ingrown or some irritation, makes that interaction a lot more comfortable. All right, guys, I hope you learned something. If you want to see some videos from us, we'd really love to do some educational videos. So if that's anything you'd be interested in, I would love to share more information. Don't forget, subscribe to the channel, and I'll see you next time.